Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
We occasionally associate trauma with something that happens physically, in a single moment, like an accident or an assault. But there's another type of trauma that builds up over time and often goes unnoticed. Psychological trauma is rarely visible to the naked eye, but it can leave indelible scars on our psyches. The emotional pain it causes can be overwhelming and affect our relationships, our work, and our overall well-being. Today, we will highlight how psychological trauma manifests itself and how we can move forward and heal, as well as answer your questions on this episode of Ask the Doc. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Rachna Baksani Mirpuri, licensed mental health therapist. Let's take our first question, and that comes to us from our very own website, allhealthtv.com, and it's from Colin. Hey, Dr. Baksani, I've been a little down lately and really can't afford to see a therapist at the moment. As such, I'd like to know if support groups and or peer support can be effective as therapy when dealing with emotional trauma. Colin, thank you so much for writing in. I'm so sorry you're going through this challenging time. I'm going to try my best to help you by answering this question. Let's talk about support groups. And yes, I feel support groups can be extremely helpful in healing from any challenging issues that we might be facing. They help us feel not alone to begin with, right? Because you feel like you're a part of people who are going through similar things, and then you feel more understood, not judged, and a little more validated. That kind of also helps bring a sense of empowerment, right? Because if we're in a support group where other people have managed to use some of those tools to heal, we can feel empowered because we know, hey, maybe if I do this, that's going to help me feel better. A lot of support groups actually teach also coping skills, especially if they're led by a therapist, or if they're led by a group leader who maybe has some information to give you in terms of coping skills, and especially coping skills to deal with emotions like anger, shame, guilt, very complex emotions when we go through challenging moments. It also helps us make new connections, right? So it enhances our feeling of, okay, I'm a part of this community, and I can connect with people who've gone or who are going through or have gone through similar challenges in life. And most importantly, it can help me learn to trust again, because those support groups can be extremely healing. And obviously, everything is confidential. So I can learn to heal and I can learn to trust. Hope that helped, Colin. All the best in your journey of healing. Let's move on to the next question. And that comes to us from Lucy. Dr. Baksani, my husband's brother, who he'd been helping try to get his life back on track, took his own life a few months back. I'm so sorry. Ken blames himself, and I think it's taking a toll on him. He's been having stomach issues and sleep issues lately. I guess my question is, can emotional trauma manifest itself physically? Lucy, thank you so much for sharing your story. I am so happy to hear that you are supporting Ken through this obviously very, very difficult time that he's going through. Let's talk about physical symptoms. And the short answer is yes. Mind, body are always connected, right? So if I'm going through something emotionally, I'm always going to have physical symptoms, manifesting. Now, some of those symptoms that I've seen in my patients who experience trauma are chronic pain, fatigue, heart issues, gut issues, insomnia, high blood pressure, some of which you've pointed out that Ken is experiencing. I would urge you to encourage him to see a therapist. I think he would find having that safe space, being able to process his feelings and moving towards his journey of healing is going to be extremely important. Thank you so much. And I hope that was helpful. Let's see what we have next. And it's a Facebook question from Fawn. Hello, Dr. Baksani. I'm pretty sure that a good friend of mine, who shall remain nameless, is in an emotionally abusive relationship. As a result, she seems to be getting more and more lethargic and depressed. I want to help, but what can I do when she doesn't want to talk about it? Fawn, I am so impressed. You seem like such a good friend. Thank you for trying to help your friend out who's obviously going through something which you've highlighted by her, fatigue or a lethargy and depressive symptoms. Let's see how you can help, okay? And let me see how I can help you help her. First, let's talk about listening. To me, one of the most important gifts that we can give to another human being is that compassionate and non-judgmental listening, right? So validating her experiences, whatever she's going through, and listening to her non-judgmentally. Remind her of all the things that she is good at and that she once loved doing, because that kind of raises self-esteem. It boosts self-esteem, which might help her with her symptoms, but might also encourage her to get help. Which brings me to the third point of please encourage her to get help from a therapist. Maybe even trying to help her find a therapist if she doesn't feel like she has it all to get on that computer and to look for a therapist. Maybe, asking around, getting some resources that you can then provide to her where she can approach and get some help. Most importantly, don't push her. Remember, it's her journey, not yours. It's hard. And I know that this is easier said than done because we want to help our loved ones. We want to reach out. We want to do everything, to support and help them and get them out of the situation that they're in. But remember, again, it's not your journey. It's her book. She's the author of it. So she needs to take it slowly and she needs to experience this journey on her terms. Continue to support her through the challenges that she's having and accept if she's maybe not ready to talk about something or if she's not ready to get help right now. Gently nudge her to go out, to engage in activities, because again, all of that enhances self-esteem. Hanging out with people who love you, who care about you, who accept you, who understand you, all of that boosts my self-esteem and hopefully then move me closer to trying to get help. I hope that was helpful. Here's our first Instagram question of the day, and it comes to us from Lewis. Hey, Dr. B, I had a pretty rough childhood. My father passed away when I was a kid, and my mother has had some substance abuse issues as a result. So I'm seeing a therapist. Yay. Now, who wants to put me on some meds? I'd like to know if there are some coping mechanisms for trauma that do not involve medication. Excellent question. I love this question. Whenever it comes up, oh my gosh, I love it because people often battle between meds, therapy, which one should I do? What's more effective? Let's talk about it. Trauma-based therapeutic techniques like EMDR, like IFS, are extremely important in the healing process. In fact, I would venture to say that medicines without therapy don't actually help in the healing process. Remember, what medicines do is they treat the symptoms, not the disease. That is done through therapy. You need to see a therapist. We need to go back and heal from all the wounds that maybe all the traumatic experiences in our childhood have created. So therapy is probably much more helpful in terms of trauma. And medicines, effective, yes, but in combination with therapy. I hope that helped answer your question. Let's move on to the next one. And that comes to us from our YouTube page. Miguel writes, Dr. Baksani, my cousin Dora was hit by a car as a child. It was touch and go for a while, but she survived. Cut to 20 years later, and Dora and I were hit by another car while driving to see grandma. It's been about a month now, and she's anxious all the time. What are the long-term effects of childhood trauma on adult mental health? Thank you so much, Miguel, and thank you so much for being so concerned about Dora. I hope she knows that she's lucky to have you in her life. Let's talk about this. I'm not sure because there's two things that have happened here. There was that car accident when Dora was a kid, but then again now, 20 years later, there's yet another one, right? So a lot of times what happens is there's these implicit memories that we have of trauma that are really triggered when then we experience a similar emotion. That's probably what's going on over here, right? So those childhood memories of that trauma or those emotions that were elicited at that time have probably been triggered again now that she went through a similar experience. Let's talk about what we can do and what are some of those long-term effects, right? So the accident obviously triggered the childhood memory of those emotions that were probably there somewhere, but not in the forefront. So she's now experiencing some of those same emotions that she did when she was a kid. The long-term effects, we see people do experience anxiety, depression, low self-esteem, trouble in relationships. Those are some of the long-term effects of traumatic incidents. I would again encourage you to please encourage Dora to get help, to talk to a therapist, process some of those, again, emotional triggers that she had as child and those that are being triggered now in adulthood. What I can assure you is with therapy, with getting the right help, Dora will be driving again. She'll be fine. She'll be back on the road, right? So we've done it several times in therapy. This is doable. So please, I would urge you to please encourage Dora to get help. Hope that was helpful. Let's move on. Our next question is from Facebook. Erin asks, hey, Dr. Baksani, I was laid off almost 2 years ago, and I still haven't been able to find a full-time gig with benefits. I've been close a couple times, but for whatever reason, I couldn't close the deal. I've gone through most of my savings trying to keep my head above water. This has become the most traumatic experience of my life, and I don't know how to get help. I'm going to start by saying, Erin, first of all, thank you for writing in. I'm sure this is an extremely, extremely difficult time for you. I want you to know you're not alone. I've had several clients experience and express similar concerns and, find themselves in similar situations. So I can only imagine what you're going through and how hard this is. Job loss is traumatic from several aspects, right? Because it gives us, it threatens our sense of stability, our sense of security, and does result in us feeling extremely anxious, sad, anger, to name a few, right? Of the emotions that we experience when we go through, like, oh my gosh, my whole world is shaking. I'm off balance right now. Some tips that you may find helpful is, first, allow yourself to feel what you are feeling, right? Remember, emotions are like quicksand. If I try to fight them, if I try to stop myself from feeling, they're just going to come back with a rage. So please allow yourself to feel what you're feeling. It's not a good place to be in. And, be compassionate, award yourself that compassion of, hey, I'm going through this really challenging time, and thus I'm experiencing these emotions. Remember and try to remember this. Try to not internalize those rejections, right? Again, what I'm asking you is extremely difficult to do. I understand. But try to look at this as just facts. Okay, maybe there's a skill that they needed, I don't have, or maybe this job situation required somebody to have X number of years of experience, which I don't have. But this is not about me, so that it doesn't bring you down. Try to reach out to your support system, right? It's extremely important when we're going through difficult and challenging moments that we reach out to our loved ones who can provide us that comfort, that support that we need. Do not stop engaging in self-care, right? A lot of times when we are down, when we feel depressed, when we feel anxious, we tend to give away all those things that actually help us feel better. So identify for yourself from mind, body, soul perspective. What are some things that help me in times that I find myself feeling low, feeling anxious, feeling depressed? Do those things. Don't run away from doing it. Don't shy away from doing those. And of course, again, like I mentioned, be compassionate. It's a difficult time. So award yourself that compassion while you're dealing with this time to get through and find a job, right? All right, hope that helped. Looks like we have another question from Instagram. And this time it's from Aurora, who says, Dr. Baksani, we recently lost my stepdaughter Lola. I am so sorry. We're all devastated, but my daughter Emilia was really close with her, and Lola's death has been very traumatic for her. Can emotional trauma from a sudden loss of a loved one cause lasting harm? And if so, how can it be healed? Firstly, Aurora, I am so sorry for the whole family. I am sure this has been nothing but challenging for all of you, and especially looks like for Emilia. And makes sense. Siblings and the loss of a sibling can have long-term emotional effects. Obviously, they share a unique bond, right? A shared history of everything that they've encountered so far. So I am sure Emilia is experiencing a loss that is so big in magnitude. Let's talk about some things that you can do. Encourage her to talk about her feelings and accept her emotions, whatever she's feeling. If she's feeling angry, hey, how, this is not fair. How can this be happening? All of that is valid, right? So encourage her to talk about it and listen to her. Be patient as she goes through this grieving process. There is no one way that people grieve. Everybody grieves in very, very different ways. So even though the loss has been for the family, the way you're going to grieve it, the way your partner, the way, maybe if there are other siblings involved, everyone is going to go through that grieving process in a different way. So allow her the freedom and the patience to go through this in the way that she needs. Ask her what she needs from you to be supportive. A lot of times we think, because again, the grieving processes are so different, we think we need to give our child support in a particular manner, but then she needs something completely different from us. So ask her what she needs. Encourage her to maintain her self-care practices, whatever that is for her. Eating right, sleeping, exercising, meeting friends. Encourage her, but don't push. Gently encourage her to do all those things that help her feel better. And last, but by no means the least, seek professional help if Emilia is having a really, really difficult time coping with it. With the help of a therapist, I'm sure she will be able to, navigate this challenging time that's bringing obviously a set of very, very complex emotions. Hope that helped. Let's move on. We have our next question from YouTube, and it comes from Flavio. Hey, Doc, My 12-year-old son is obviously depressed. He used to play sports with friends, interact with schoolmates on social media, and shoot hoops in the backyard with his sister. All he does now is watch TV in his bedroom. I want him to get some help, but he's adamant about not going to therapy. Can emotional trauma be healed without professional help, or is therapy necessary? Wow. Flavio, first of all, thank you for being such a great dad. Um, it's a little difficult for me to answer this question without knowing what kind of trauma your son might have experienced, right? So, in our world of trauma, we refer to them as the big T's and the small T's. The big T's are obviously the things that we go through in life that leave us completely um, bruised in a way. And the small T's are things that happen on an everyday level, but still can cause traumatic emotions within us. It's hard for me again to answer. However, for traumas, definitely, for any kind of trauma that a person is experiencing, offering support to them is definitely the first way to go. Validating what they're feeling, listening to them, encouraging them to talk about what they're going through. Even though he doesn't seem like he's yet there already, but letting him know, hey, I'm here. I can see you're going through a difficult time, but I'm here whenever you're ready to talk. Also, as a reminder, please ask him about self-harm, right? Because a lot of the symptoms that you're mentioning are indicating depression. So just to put it out there, you do need to ask him about any thoughts of self-harm, so as to ascertain that there are no thoughts of suicide or self-harm over there. Because if that is the case, then that's an emergency and you need to take him to the hospital. If not, like I said, it's a push and pull, right? So pushing him a little bit and knowing when to pull back, allowing him the space to come to you when he's ready, with the knowledge that you're there, loving him unconditionally through this difficult time. Hope that helped. We have another question from All Health TV, and that comes to us from Sabrina. Hello, Dr. Baksani. I grew up in a very toxic environment and suffer from anxiety and depression. I've tried therapy and antidepressants, but to no little or no avail. I really need to know if there are any emerging treatments and or therapies for emotional trauma that show promise that aren't widely known yet. Excellent question, Sabrina. Let me go with my favorite. Little bias over there, but I am biased towards IFS, that's internal family systems. In my opinion, one of the most compassionately complete treatments of trauma there is. However, they're not. The challenge is there are not too many therapists that are trained in IFS. To start your journey, however, I would encourage you to buy the book No Bad Parts by the founder of IFS, who is Richard Schwartz, and start to read it, because that's kind of a self-help journey till you are able to find a therapist who practices IFS. Hope that was helpful. Let's move on to the next question really quick. Hi, Dr. Baksani. What role does mindfulness or meditation play in healing from emotional trauma? I love this question because I am a big believer of mindfulness and meditation. How does it help? Let's talk about that. It helps you become more self-aware and focus on the present. It helps increase self-compassion, right? So, which is extremely essential in healing trauma. It helps me emotionally regulate. It helps me get back to that wise mind when I'm in my emotion mind. Remember, when I'm triggered with the emotions, that get triggered in traumatic experiences, I move into a place of emotion mind. This helps me bring back myself to my wise mind, and then I can act from there. It helps bring acceptance of traumatic experiences, which I think is so key in healing from it. Hope that was helpful, and I truly encourage everyone to try mindfulness and meditation techniques if you have experienced any sort of trauma in your life. That's all the time we have for today. I'm Dr. Rachna Baksani Mirpuri, and we'll see you next time on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.